This is another video related to the topic of health and the people 1000 AD to the present day, which is on the AQA Spec. It focuses on the problem of blood loss. We've already looked at the problem of pain and the problem of infection during surgery throughout time. So this is really seen as the third and final problem. Let's start off with a reminder on how the blood groups were discovered, which helped with the development of blood transfusions.
In 1900, Carl Landsteiner discovered the different blood groups. He realised that different blood groups were not compatible with each other and that blood transfusions are likely to be successful if the blood groups are matched. In the early stages of blood transfusions, the blood donor and the patient had to be together for the transfusion to be carried out. In 1915, Richard Lewison discovered that sodium citrate prevented blood from clotting. This made it possible to store blood for longer periods of time. Blood banks soon became established.
So we're going to have a look at that 16 marker factors question a little bit later. So we know how important the factor of war is. There was a greater demand for blood transfusions during the First World War, which heightened the need to store blood. The practice of donating blood, storing it, and later someone receiving it progressed during the interwar years and during the Second World War.
In 1938, in preparation for the Second World War, the British government set up a national blood transfusion service which created large blood banks supplied by around 700,000 blood donors during the Second World War. In 1940, it was discovered how to make blood plasma, basically dehydrated blood, which made it easier to store and transport. And by the end of the war, plastic wallets were used rather than glass bottles. After the Second World War, people continued to volunteer to donate blood, often influenced by adverts from the NHS. This system is still in use today.
Don't say it. Please don't say it.
I don't mind giving a reasonable amount, but a pint? That's very nearly an armful.
So our 16-mark question is, has war been the main factor in the development of surgery since the Renaissance? Explain your answer with reference to war and other factors. So the other 6 factors we need to consider when answering this question are superstition and religion, chance, government, communication, science and technology, and the role of the individual. If we just take the time to quickly break down the question, so war is the factor that is in the question, so we must analyse that, ideally in our first paragraph. Surgery is the specific area of health and the people that we are looking at, so it is not medicine or public health, but specifically the practice of surgery. And the era is the Renaissance. So your first section, analysing the factor of war, may look like this. War has significantly influenced the development of surgery since the Renaissance era. For instance, during the Crimean War, Florence Nightingale implemented hygiene and sanitation practices, leading to a decrease in mortality rates among wounded soldiers. Nightingale's emphasis on cleanliness highlighted the importance of hygiene in medical settings, reducing the risk of infection and improving surgical outcomes. However, it was not until Louis Pasteur's discovery of the germ theory in 1861 that Nightingale's methods were proved to have been scientifically beneficial to her patients. Similarly, World War I saw the widespread adoption of blood transfusions and the development of plastic surgery techniques by Harold Gillies to treat soldiers with severe facial injuries. These innovations in blood transfusions and reconstructive surgery were driven by the urgent need to address the injuries sustained during the war. The demand for transfusions highlighted the need to be able to store blood for longer periods of time. In 1915, Richard Lewison discovered that sodium citrate prevented blood from clotting and could therefore be stored. This enabled the setting up of blood banks. As a result of this, many lives were saved during surgery where the patient had lost a lot of blood.
Now, a productive revision session that you could set yourself could be to finish the answer to that question. You could do a second factor, a third factor, and then a conclusion, making your final decision. You could possibly re-go over that first paragraph that I've just gone through with you and see where you can maybe add bits, replace bits, take bits out, make it more concise and still be just as effective, because admittedly, it is quite long. I hope this video has been of some help to you. Do subscribe, do leave a like and a kind comment if you have found it helpful, and good luck if you've got exams coming up.